afternoon, whatever the case may be. I'm going to talk a little bit about DOD Global Health Engagement terminology and structure. As we have taught and presented to really our medical students over the last couple of years, it was clear to us that there's a lot of terminology and there's a lot of reference to military structure that many people in the military that have been in the military for a number of years probably don't understand. So we thought best maybe to set the stage with a discussion and a presentation for these terms and that structure that they're going to be or you're going to be receiving in the coming days or coming months, that will just give you that foundation as to assist the understanding and the education process. Agenda slide. We will talk very quickly purpose, give an introduction to the subject, but then look at DOD Global Health Engagement, talk about the structure surrounding the Geographic Combatant Commands, the Department of Defense, and then really from a United States perspective, U.S. Global Health. Really that is stepping back a little bit further from that technical interaction in a country to those overarching strategies that the U.S. government employs, and then we'll close things down. So with that next slide, the purpose, again, to provide an overview. Really the bottom line is to present and describe a variety of the terms and structures that you're going to hear about. And hopefully this will help you understand as we step through some additional training topics, some of this education process, that you'll understand the terms, or at least have a reference point for the terms and the structures that we talk about. And again, hoping that will give you a better understanding of DOD Global Health Engagement in its entirety. This introduction slide, you are likely to see this again, as I stole it from one of our future presenters, but stepping from the bottom up, this is how I'm going to present the information, that there is a tactical level interaction, whatever that interaction might be, that is, at least from my characterization, that broad range of things that fall within DOD Global Health Engagement. So we'll spend some time talking about the specifics, specific terms that discuss and surround that interaction, but then we step back a little bit from that tactical interaction or that contact from us, from the U.S. military to this partner nation, and talk about the COCOM structure and how that supports or guides those tactical level interactions. Take one step back from that at a DOD level there are a variety of entities that impact, that shape, that look to influence how health is used across the globe, and then finally step back to a U.S. government perspective and the offices, the agencies, the entities that impact and shape and execute global health activities that might be in parallel with what the military is doing, but in many cases it's those programs that are really the prominent role, the prominent place that the United States has in global health engagement. DOD Global Health Engagement, that next slide, this is a listing of a variety of terms, again, that will shape, that will allow, that will authorize the use of both DOD money and DOD personnel for global health purposes. Stability operations, really the broad range of activities that are not combat operations. At least we are to be able to execute those with the same proficiency that we execute combat operations. Within this stability operations umbrella, there are a variety of activities, there are a variety of things that may happen, that may be executed. Iraq, Afghanistan are probably our best examples of things that once there was a transition from pure combat operations, there were many activities, many efforts to build capacity, to build or strengthen existing systems, to restructure or to create entities, organizations, capabilities that did not exist previously. And again, there's a broad range of things that fall underneath that stability operations umbrella, but basically it's those things that are not pure combat operations. So all that support, that assistance that happens outside of a combat environment. Security cooperation are those varieties of things that the U.S. military interacts with, those ways they interact with a partner nation. And so the idea is you're building or stabilizing a country that you're adding to their security and their stability, which in turn impacts the security and the stability of the United States. Again, a broad range of things happen in there, a lot of them contact, but there is, again, strengthening and building of capability within to a partner nation, specifically a partner nation's military. So that mill-to-mill component of this global health engagement that in part is designed to elevate their capabilities, to elevate their level of competency. Part of that thought is if we partner with them, if there is a collaboration, if there is a coalition in the future, that their ability from a medical standpoint is maybe not on a par with how we conduct operations or how our health services are provided in the DOD, but they understand and their level of the level of care they provide and their methodologies are similar to what we provide in the U.S. military. Again, as we kind of step through these different elements, humanitarian assistance, largely it is those things that are an interaction between our U.S. military health system personnel and the civilian population. That things fall in there like the construction of schools, the building of clinics. Again, it's a point-in-time impact on a civilian population. It's possible, and the next bullet is disaster relief. So that humanitarian assistance might include those disaster relief activities, but it is much broader than just disaster relief. Disaster relief, as the word implies, it's that immediate response to a disaster, whether that be a man-made or a natural disaster. Historically, the U.S. military, probably it's the logistics of the transport capability that gets more play. That is our strength, but there's also an opportunity and a potential for health interventions, for health units to be placed into the field to support the population impacted by that disaster. The next few terms I've referenced, mill-to-mill, is that military-to-military contact, so U.S. military to the military of one of our partner nations. Military to civilian is that interaction from our military to that civilian population. I referenced that under humanitarian assistance, but it's really at a point in time. U.S. military provides a service, provides it could be construction, it could be equipment, it's something where the U.S. military is providing and impacting that civilian population, but the focus is at a point-in-time impact. It's not a sustained involvement, a sustained interaction, but it is a point-in-time interaction. And civ-mil, to differentiate from mil to civ-mil is, at least my characterization, is those things where we interact with, we coordinate with, we plan with, we collaborate with our civilian partners, whether that be civilian partners in the U.S. government or non-governmental organizations, international organizations, but it is that interaction to provide a service or to execute a mission that is the planning and coordination, as opposed to mil to civ, where it's our military impacting a civilian population. And finally, the DOD Global Health Engagement. We've talked this a little bit, I've mentioned it a little bit. It is encompassing all of these things. So for our purposes, as we go through this training, DOD Global Health Engagement is that broad range of activities that fall under a health umbrella that are executed by the U.S. military. Geographic Combatant Commands is our next topic, and that is really the umbrella for all the activities, all the interaction that occurs around the globe. The DOD has divided the world into pieces. Those are geographic components or geographic combatant commands. That command has responsibility for the relationships, military to military primarily, but also military to civilian relationships that are associated or that operate within that geographic region. Now, if we flip to the next slide real quick, that is as the division across the world for the different commands and the responsibility or the area of responsibility that they have. Again, that COCOM is responsible for relationships within that region, but also for the contact that occurs in that region, and if there are operations involved or ongoing in that region, they are the authority and the responsibility for those operations. So back to the previous slide, the one entitled Geographic Combatant Commands, we have geographic regions, so the COCOM is responsible for the military-to-military relationships as well as the military-to-civilian relationships. They also have operational control of operations within their area of responsibility. That might be through a task force or a joint task force, where there is a force that's placed on the ground for a purpose. The Horn of Africa comes to mind. We have a joint task force, Horn of Africa, that is responsible, and their role has primarily been interdiction and prevention of Al-Qaeda or Al-Qaeda-like entities finding a foothold and using that as a refuge to then impact both the United States but the surrounding countries. That being the mission of the Horn of Africa, they are a joint task force, and with that mission there are a variety of opportunities from a health perspective to engage with militaries in that region, but also to engage with the civilian population. But that joint task force, Horn of Africa, answers to the African Command, and so an example of the operational control. Iraq and Afghanistan, both operationally, answered to the commander at the U.S. Central Command. It lists the U.S. Embassy here, not to say that it is subordinate to the Geographic Combatant Command, but to state or point out that the embassy is intimately involved in anything that we do with the country. The ambassador is really the trump card. They own all the activities that happen within that country. So stepping away from a scenario like Iraq and Afghanistan, any other country, all that coordination runs through the U.S. Embassy and is authorized by, they may say no, but they are authorizing those activities with that partner nation. Within the U.S. Embassy is a defense attaché, which is really the military advisor to the ambassador. For many practical purposes, they are the intelligence entity within that embassy and within that country, so watching out for and keeping track of the relationship with that partner nation military. Reference the military group or the Security Assistance Office, and from an engagement standpoint, they are the ones that maintain the day-to-day relationship between the U.S. military and that partner nation's military. So they are a coordinator, a facilitator for any activities that we seek to conduct with that nation, to include bringing our folks into that country to interact, to execute a mission, whatever that may be, but also for those things where we would bring military members out of that nation, out of that country to the United States for interactions, for meetings, again, whatever that contact may be. They are the facilitator, and they are the ones that bring those pieces together for those missions to happen. And the last item there, the component service underneath each geographic combatant command. The combatant command does not own the forces that operate in that theater, but those are owned by the services. So there is a service component, Army, Air Force, Navy, and Marines, and Special Operations that operate within and support that combatant command. So typically those activities from a health engagement standpoint that are done within that COCOM's AOR are conducted by members of that service component, primarily, well, Army, Navy, Air Force, or Marines, depending upon the mission and depending upon what they are seeking to achieve. To step back one more level, we'll flip over 2 slides, I believe. It's the Department of Defense. Again, just referencing a number of entities that interact, that influence, that shape how health engagement is conducted within the Department of Defense. Out of OSD policy, they, again, as it states, it's policy. Many of these are policy level entities that are putting documents together that are providing guidance to say this is how we will operate, but not necessarily saying specifically what will happen within a given geographic region. So policy, producing policy as to how global health engagement will be carried out and giving some parameters to shape activities. Health Affairs has an international health division that is involved in that policy process, that are involved in enabling or assisting those at a COCOM level really to execute that mission. Joint Staff has an entity also that's looking to or with a mission to support the Geographic Combatant Command Surgeons offices in the way they execute, in the way they shape, in the way they try to manage their health engagement within the region. Defense Security Cooperation Agency, as it states, is really the umbrella for all security cooperation activities, so very broad in scope with the things that they manage, but they are a funding source, a sponsor for components of DOD global health engagement. And then you have the services. Each takes a slightly different perspective to global health engagement. List the Air Force there with the International Health Specialist Program, a program that was created in the late 1990s. There are a number of full-time Air Force officers that support the geographic regions from a global health engagement standpoint, so both developing and managing but executing missions. And you have a full-time cadre, and then you have a number of health system personnel in the Air Force that have been designated for their language, for their cultural skills, for their operational experience, and with the idea that if you have a mission in a certain country, certain location, that you can reach back to that population and hopefully match someone with experience in language and cultural capability with that mission in that particular place. The Navy has established a Global Health Specialist Program. I'm sure you'll hear a little bit more about that in its infancy, but developing as to their capabilities and how they approach global health. And that's not to say the Navy hasn't been doing global health for a long time, but recently they've established this office and try to shape how they prepare people to execute those missions. And finally, the Army, they don't have a specific career field, they don't have a specific office, but again, the Army interacts globally in a variety of ways. You can look at the civil affairs community and special ops, and they are out day to day conducting global health engagements. So again, slightly different perspectives from each of the services, but each of them very engaged in the global health mission. And this next slide, again, stepping back one more level, we step from a tactical level where there's actually interaction and contact between the U.S. military and a partner nation. Then looking at the COCOMs, looking at the Department of Defense, and this last slide is looking at U.S. global health. So it is the variety or the different departments and the programs that impact, that shape, that enable global health from a U.S. government perspective. Certainly Department of State, they have an Office of Global Health Diplomacy, so they're looking to shape and they're looking to understand and how best to utilize global health or health from a foreign relations standpoint. USAID is part of that process, which is our primary developer or development agency, so conduct development activities throughout the world. So often there are health components to those development activities. Health and Human Services and the Centers for Disease Control and Prevention, both very active globally in a variety of different programs. And then there are other agencies that might not have a pure health mission, but there are health components to what they do. Department of Agriculture comes to mind, animal health. There's a variety of things that might be a complement to a pure health activity. And so again, from a U.S. government perspective, there are departments that have a responsibility for different components of this mission and interact within the global health arena. And as we have departments, we have specific programs at U.S. government level that are really the source of funding, some very substantial funding that impacts health throughout the world. Global Health Initiative was established by President Obama with the thought that we are going to better coordinate and better plan our health initiatives. That is, I think, an ongoing and growing process. PEPFAR is the President's Emergency Plan for AIDS Relief, so established under the Bush administration. It gave something to the tune of $5 billion a year for prevention, but primarily for treatment of those infected with HIV. And so looking to impact and shape and stabilize those countries that have been decimated by that disease. And again, there are other programs. There's our the neglected diseases, there's malaria, there's tuberculosis, there's multiple programs where there's funding specifically linked to countering or eradicating those diseases. And so again, from a U.S. government perspective, you have the different departments that have a focus and have an impact in global health, and then you have programs that specifically are designed to impact unique components of global health. I think that kind of brings us to the conclusion slide there. So again, I hopefully give you at least a starting point and understanding of the terminology and the structures that support DOD global health engagement. So first talked about that, to me, very tactical level. It's the interaction between two people. It's the interaction between the U.S. military and that partner, whether it be a partner military or a partner civilian population. So that tactical, there's a broad range of things that fall within that global health engagement umbrella. We talk geographic combatant commands as that structure and the authority to allow health engagement in different areas of the world. We talk the Department of Defense and their role and their role in shaping and enabling the execution of global health engagement activities, and then finally the U.S. government and how the U.S. government from different departments, but also with programs, directly impacts health across the world. Again, we hope this kind of sets the stage. You're going to be hearing a lot of these terms, a lot of these structures again, but we wanted you to have a starting point and at least to help your understanding as we hit these different terms and these different structures.